Om Sai Ram. As you are aware, the COVID-19 pandemic has led to unprecedented and unanticipated challenges requiring collective action and support from all. While all necessary measures to fight the spread of novel coronavirus or the COVID-19 are being effectively led by the central government and state governments, there is a need to reinforce the importance of preventive measures and practices in a sustained manner to deal with the disease over the long run. Here we outline a comprehensive list of 15 preventive behavioral practices which are critical to winning this fight against the deadly virus. This fight can be won only when everyone knows their goal. Everyone knows their role. We need to follow a set of 15 promises as part of COVID-appropriate behaviors. Number 1. Greet without physical contact. Avoiding physical contact is a responsible behavior as it prevents the spread of COVID-19 disease and other viruses. Number 2. Maintain physical distance. Following distancing norms in all public places, keep a minimum distance of 6 feet, especially when you go out to shop for essential products to the vegetable or fruit market, dairy store, pharmacy, hospitals, etc. Also, follow distancing norms when in a room or office with other people. If the other person is infected, their physical contact may increase the risk of transmission. Number 3. Wear a reusable handmade face cover or mask at all times. A handmade face cover or mask limits the spread of any respiratory infection and protects the community at large. However, always remember, wash hands with soap and water or use an alcohol-based sanitizer before wearing a mask. Number 4. Avoid touching your eyes, nose, or mouth. We tend to touch our face inadvertently. Let's be extra careful. Hands touch many surfaces and can easily pick up germs and viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and can make you sick. Your safety is in your own hands, quite literally. Number 5. Maintain respiratory hygiene. Cover your nose and mouth when you cough or sneeze with tissue or handkerchief. Don't forget, wash hands immediately after you cough or sneeze. Number 6. Wash hands regularly and thoroughly. Your safety is in your hands. Wash your hands frequently and thoroughly with soap and water. Alcohol-based hand sanitizer can be used if you don't have soap and water facility. Number 7. Regularly clean and disinfect frequently touched surfaces. Practicing good environmental hygiene makes your surroundings safer. Because the infected droplets are likely to settle on surrounding surfaces, you may use chemical disinfectants to clean the surfaces. But don't forget to wear gloves during disinfection. Number 8. Do not spit in the open. Every time you spit in a public place, you put your and everyone else's life at risk. Spitting in public places can increase the risk of COVID-19 spread. This also includes spitting after consuming smokeless tobacco products. Remember, spitting in public places is also punishable by law. Number 9. Avoid unnecessary travel. Travel only when it is absolutely essential. And if you do step out of the house, wear your face cover and follow distancing norms. Number 10. Do not discriminate against anyone. Show compassion and support to persons affected with COVID-19 and their families. Remember, as people keep a check on any symptoms associated with COVID-19 and are willing to undergo testing, they also provide an opportunity to beat the disease. For that, you can download the Arogya Setu app to monitor your health. Boost the morale of doctors, nurses, police, sanitation workers who are on guard 24/7 to protect us. It is time to show care. C for compassion, A for assurance, R for respect, and E for encouragement. Number 11, discourage crowd, encourage safety. Limit going to social gatherings and say no to crowded places. Unnecessary travel to crowded places or large gatherings increases the risk of COVID-19 transmission. Keeping a reasonable distance of at least 6 feet from others is another important thing to remember. For important events which cannot be postponed, keep the number of guests to minimum. Number 12. Do not circulate social media posts which carry unverified or negative information. Number 13. Seek information on COVID-19 from credible sources. There is COVID-19 related information coming from so many sources, but you must only rely on the most credible source for COVID-19 information, and which is from the Ministry of Health and Family Welfare's website. You will receive all updated information and facts related to COVID-19 there. Number 14. Call national toll-free helpline numbers 1075 or state helpline numbers for any COVID-19 related queries. If you have any COVID-19 related queries or observe any COVID-19 related symptoms like fever, cough, or difficulty in breathing, call the national helpline number 1075, which is toll-free. Do not hesitate to disclose your symptoms. The earlier you seek help, the faster you will beat the disease. Number 15. Seek psychosocial support in case of any distress or anxiety. Coping with any public emergency or outbreak can be a testing time for people and their families, both affected or unaffected. Do not ignore or suppress any feelings of anxiety or distress. Psychosocial support services are available at all times for you to address any stress or distress-related queries or concerns. So you can call on the National Psychosocial Toll-Free Helpline number 080-4611-0007. Together, we will fight the COVID-19. Om Sai Ram.